If you have found yourself with UTIs in perimenopause or after menopause, the real reason for this has little to do with hygiene and everything to do with hormonal changes. So let's talk about what is actually happening and what actually helps. So if you found yourself back at the pharmacy for another round of antibiotics, wondering what you're doing wrong, I want to offer a different explanation. For many women over the age of 50, recurrent urinary tract infections are not a hygiene issue, a hydration issue, or a sign of anything else. They are a hormonal signal. And once you understand the mechanism, the treatment becomes that much easier. So let me walk you through what's actually happening in the body, why it becomes so common in the menopausal transition and beyond, and the options that address the root cause rather than continuing to treat the latest infection. So first, I want to talk about why UTIs suddenly become a pattern. Recurrent UTIs are defined as 2 or more infections in 6 months or 3 or more in a year. Many women sail through their 30s and 40s with the occasional infection and then find themselves dealing with them repeatedly once they reach perimenopause and menopause. The common thread here is estrogen. As estrogen declines, the tissue of the vagina, urethra, and bladder change in ways that make infection considerably more likely. The cluster of changes is called genitourinary syndrome of menopause, or GSM. And recurrent UTIs are one of the most frustrating features and remarkably under-discussed in standard appointments that are talking about menopause. Often we are super focused on the conversation around hot flashes and night sweats, but we don't talk about vaginal dryness and UTIs. And oftentimes when I'm asking patients in an appointment, running through the list of symptoms, I'll say, and when was the last time you had a UTI? And they'll be kind of surprised as if I've gone off topic and I'm talking about something. Wait. I still want to talk about my menopause. They don't realize that it is so related to what they are experiencing. So let's talk about the estrogen and microbiome connection. So before menopause, the vaginal environment is populated by protective bacteria known as lactobacillus. These bacteria produce lactic acid, which keeps the vaginal pH low and acidic, somewhere between 3.5 to 4.5. This acidity is protective. It makes the neighborhood inhospitable to the bacteria that cause most UTIs, particularly E. coli, which travels from the digestive tract and also can travel from underwear. I specifically call thong underwear E. coli tightropes for this very reason. And knowing this is one of the things, once you know, you can't unknow, and might be the reason you start using full back underwear. Estrogen is what feeds the system. It encourages the vaginal cells to store glycogen, which is the fuel lactobacilli use to thrive. When estrogen falls, glycogen falls, the lactobacilli population shrinks, the pH rises and becomes more alkaline. This shifts and opens the door to the bacteria that used to be kept in check. They now have a friendlier environment in which to colonize and climb towards the bladder. So the recurrent infections are often downstream of a microbiome that has lost its protective balance. Estrogen also keeps the tissues of the bladder and the urethra plump, elastic, and well supplied with blood. Now, as the estrogen levels decline, the tissues become thinner, drier, and more fragile. The urethra can become shorter and less able to act as a barrier, and the bladder lining loses some of its resilience. This is why so many women notice several things arriving together: more frequent infections, more urinary urgency, a sense of needing to go more often, discomfort with intimacy, vaginal dryness, and irritation. These are different expressions of the same underlying tissue change. And then there's another layer worth understanding. With age and hormonal shifts, some women experience changes in how completely the bladder empties. When urine sits in the bladder longer, bacteria have an opportunity to multiply. Pelvic floor changes, prolapse, and altered bladder mechanics can all contribute to that residual volume, and they become more common in the years around and after menopause. This is a reason why thorough assessment matters. Two women with identical symptoms might have quite different drivers, and the most helpful plan depends on the factors that are actually at play for you. Now, antibiotics have an important role. When you have an active confirmed infection, they can treat it. The difficulty is that they do nothing to change the underlying environment that allowed the infection to take hold in the first place. They also reduced beneficial bacteria along with the harmful ones, which again can leave the protective microbiome even more depleted afterwards. This is the cycle so many women find themselves in: infection, antibiotic, brief relief, and then another infection a few weeks or months later. Breaking the pattern usually means looking past the individual infection and asking why the terrain has become so welcoming to bacteria in the first place. The encouraging part is that once the root cause is understood, there are meaningful options. So here's a picture of what an evidence-informed approach can include in someone with recurrent UTIs in perimenopause or menopause. Now, this is just for educational information, and the right combination for you should be worked out with your own practitioner. But first, we have vaginal estrogen therapy. It is one of the most studied interventions for this specific problem. Applied locally to the vagina and the urethral tissues, it works to restore the tissue thickness, glycogen, lactobacilli, which is those good bugs I'm referring to, and healthy pH that decline with menopause. And because it acts locally, systemic absorption is low. For many women with recurrent UTIs driven by genitourinary syndrome of menopause, this is the intervention that finally shifts the pattern. This is worth a specific conversation with your provider about whether or not it's appropriate for you. And restoring the microbiome is a complementary piece, supporting healthy lactobacilli, addressing the digestive and vaginal microbiome together, and thinking about the whole ecosystem rather than a single infection can help rebuild the protective environment. And I'm often telling my patients about how the gut microbiome and the vaginal microbiome and the uterine microbiome, although they are different and distinct in the type of bugs that they like to house and the type of bugs that find a comfortable home there, they do work towards, each other in a state of ecosystem balance. So if the gut is off in its own way, the vagina or the uterus is more likely to also be off in its own way. Not necessarily having the same bugs, but dysbiosis tends to go throughout multiple systems. Then we have targeted preventative strategies such as adequate hydration, urination after intimacy, and certain evidence-supported compounds like D-mannose, which can interfere with E. coli sticking to the bladder wall, can play a supportive role for some women. These are additions to a root cause plan, not replacements for it. And a proper assessment rounds it out, confirming infections with a culture when possible, checking that the bladder is emptying well, reviewing pelvic floor health, and looking at a full hormonal and lifestyle picture can help ensure you're treating the actual driver. If you have been quietly struggling with this, I hope this gives you a more accurate story. Recurrent UTIs after menopause or in perimenopause are a predictable consequence of declining estrogen and the tissue and microbiome changes that follow. This is a very different starting point than assuming you are simply prone to infections, because this points towards solutions that address the cause. If you have questions, comment below, and I'll see you in the next video.